Well, this is a pelvic ultrasound that of a 20 years old married 1 year, no issue, came for to rule out any pelvic pathology as she wished to conceive and is not conceiving so far. So what's seen on the ultrasound is now this is the uterus. This outer lining is that of the uterus. This is the anterior myometrium. This is the endometrial canal, and this is the posterior myometrium, in which you are seeing two hypoechoic focal lesions. This is one, and this is the second one. Now these are fibroids relating to the posterior wall of the uterus, with and sparing the endometrial canal. No pressure effect is seen on the endometrial canal. Therefore, she has normal periods. There is no history of polymenorrhea. Rather, history of dysmenorrhea is present. Now, if you concentrate on this side of the image, these arrows are indicative of endometrial canal, and these are small subserosal fibroids in the anterior wall of the uterus. This is the anterior wall of the uterus, and this is a large hypoechoic fibroid relating to the posterior wall of the uterus, but having no pressure or mass effect on the central endometrial canal, a clear endometrial canal. Now, what is this area? This is a cyst, a small echo-filled cyst with no calcification or solid element, measuring 27 by 26 millimeters, and this is very much consistent with endometrioma, chocolate cyst, with the history of dysmenorrhea. And interesting thing, it can be infective, no doubt, until and unless you are provided with the adequate now you see this is the uterus, outline of the uterus, measures 8.5 by 4.7. This is a relatively enlarged size for nulliparous. Now this is the anterior myometrium. This is the posterior one, in which you are seeing black focal lesions that are fibroids, small fibroids. This is the cervical canal. This is the cervix, and this central echogenic area is representative of endometrial canal. This is the fundal region, and this is the longitudinal section. And you can see there are outpoachings from the fundal region as well also. This is one, this is two. Now these are fundal region subserosal fibroids. This is the endometrial canal. In this section, it will depend on the view I am taking. And this is a subserosal fundal region uterine fibroid. This is the uterus. This is all uterus. You can see a few other with the posterior wall, as for example, this is the fibroid. This is a small fibroid carrying black hypoechoic. This is again a fibroid. So multiple fibroids. This is also a small fibroid, subserosal in location, and this small rounded hypoechoic area is also a fibroid. None of the fibroids is having any effect on the central clear endometrial canal. And this is the urinary bladder. This is so. This is from one view that the pathology we are getting. So let's move ahead with, now this is the transverse section, and in transverse section you can see that this is a fibroid, well demarcated, this one. This is a fibroid, intramural, leading to the posterior wall of the uterus. This is the endometrial canal, and this is the anterior myometrium in this view. Also note that there is a cystic area, ecophyll cystic area with the posterior wall, in the region of the right adnexa with right ovary, not right. So this measures approximately 29 by 35. So this is a retention ovarian cyst that is full of internal echoes, and there is no calcification seen in it, no solid element. So this is consistent with, again, a cyst of infective nature or an endometrioma. It will not change its shape while I am giving a sweep to the probe. The second one is now left over. This one. There is the another one is this. Now this is the second one in view. This one. This is the second one with full of echoes. Measuring 25 by 29 millimeters. Bilateral retention. Ovarian cyst. This is the right side that we are seeing. And this here I will try to focus the both together. Try to both. Now this is a fibroid. This is not a cyst. Its origin is from the posterior wall of the uterus. This is the endometrial canal. This is the uterus in transverse section. This is the cyst that we have just discussed, and this is again the cyst that we did discuss just now. This is the uterus in transverse section, and this is the endometrial canal. This is the fibroid. So it's quite clear the cause of infertility for this female are multiple fibroids, both intramural, the largest in the posterior wall, rest all are subserosal in location, both in anterior wall, posterior wall, at the fundal region, with the bilateral retention ovarian cysts that are full of echoes, suggestive of being either infective in nature or endometriomas. Thank you very much.